Hi Beth,
Hi Jack,
how you doing?
I'm good, are you?
Yeah, not too bad, thank you.
So, fancy telling me your story?
I had my first stoma in March of 2013.
Yeah.
That was supposed to be a temporary stoma for 3 months, but unfortunately, as soon as they fitted the stoma, they found out I got a problem with my small bowel, so it couldn't be reversed.
I know.
Basically, it's now my bag for life.
Yeah, my boyfriend works at Medilink and I've been told that you use them. So, what do you think of the service?
I use Medilink basically because of the support I get from them. With my previous suppliers, there was no support there whatsoever. Whereas with Medilink, you've got the nurses. Any questions about supplies or anything like that, the staff there are always willing and always help you, and whether it be home visits or whether you come up to the branch itself.
Yeah.
I've always had a lot of support from them, which to me goes a long way. The Osterpals as well that they formed, the support group. I was a founding member of that. A lot of help that I get has always been from speaking to someone else with a stoma.
Yeah.
Because although the stoma nurses are trained in everything that they do, they don't live with one, if you know what I mean.
You can compare experiences.
Exactly, yeah. But the majority of help has always been from the help, within the group meetings and things that Medilink have held.
Yeah.
So which part of the company do you work in?
I work in the engineering in production.
How did you get into that?
I did my work experience with Salt when I was 14 and they wanted me to apply for the apprenticeship then and there. But obviously due to circumstances I was still in school taking my GCSE, so I had to reapply 2 years later when I turned 16. And I sort of just got into it from there really. I was looking at engineering from about age of 13 or something. I like taking things apart and putting them back together again.
So you like working with your hands then?
Yeah.
Yeah.
It's the job I'm doing at the moment is more working with team leaders on the shop floor to help make their life easier basically. So at the moment I've created folders with all the tooling on and they can just go, right, that's the tool I want, put it in an order, send it off. It just makes life a lot easier as well because otherwise they have to go, right, I need the price for this. Then it's back and forth and it makes things so much more complicated when it doesn't need to be. I've heard you're from a similar background.
Yeah, well,
Mechanical.
sort of mechanical, yeah. I've basically all my life I've been racing cars, working on cars and things like that. So from the age of 7 I was racing cars and my dad always made me fix my own cars when everything went wrong, showed me how to do it. And when I left school I went into repairing cars, crash damaged and anything like that. From that then I went into the management side of it.
So it was more of a passion than just a job role really for you?
In all fairness, yeah, it was. It was cars and motorbikes, things like that. Anything mechanical has always been my life. It's what I grew up with and what I know. And to do something that you love is a big thing. If you can do that, that's worth all the pay rises in under the sun. It's just to do something where you want to get out of bed of a morning to go to work.
So for my apprenticeship, I have to go through a series of training. I got to see the patient side of things. So I went to Edinburgh with one of our marketing managers and I got to meet plenty of patients coming in and out and I got to hear loads of stories.
Well, with me, I knew that I was going to have the stoma and it was all pre-arranged, but mine was only supposed to be temporary. But after having it, it has made a huge difference to my life, to the control I've got over everything. I've got a toilet finder app on my phone, and if I've got to go anywhere, I will plan my journey ahead of time, knowing where all the toilets are, so that at any time I can come off the journey and get to a toilet whenever I need to, because my bag can fill up within seconds.
Yeah.
The urgency is there, and luckily there's tools out there that can help you. Everything you do, I have got to plan ahead and just make sure I know where I'm going at any one time. And
so it come as a shock to you, but a good shock, really.
It did, I suppose, yeah. It come as a shock to say that I've got to have it permanent, but at least it gives me more control over my life than what I had previous.
Yeah,
so I wouldn't be without it now.
No.
No, definitely not. I wouldn't reverse it. even if I could.
So I just want to say thank you for sitting and chatting with me, because obviously hearing about your experiences and where it's been negative but it's also positive at the same time really helps me out. I can sit there listening to patients and taking their opinions of what they think, and then I can take it back to my department and we sort of go, right, okay, so this patient said this one said the exact same, so what can we do to improve it? And I just want to say thank you for meeting up with me.